Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal, and in this video I would like to talk about the life and work of Milton H. Erickson. Now, Erickson is considered to be the father of modern hypnosis and someone whose ideas really span for generations and from different therapeutic approaches. Erickson is considered to be a very important but also very polemic figure. A lot of people criticize the ideas and ways of Milton H. Erickson, especially his therapeutic approach, but also the fact that Erickson was associated and defend the use of hypnosis in the medical setting, but also in the therapeutic setting. But let's not digress. Milton Wyland Erickson was born in 1901 as a son of farmers. His parents were humble farmers that worked the land. As a young boy, Erickson and his family moved to Wisconsin in the United States, and he grew up really a lot of years in Wisconsin. He was the youngest of 7 or 8 siblings, boys and girls, and as a child, Erickson was a very curious person. He was very eager to learn and to observe everything. As a young teen, Erickson read all of the dictionary and really read all the words that were in the dictionary. So, in the communication point of view, Erickson was very eloquent in the use of words and their meanings. Before the age of 18, Erickson would have his first polio stroke. Nowadays, polio is a manageable disease, but in those days, polio was a very chronic and fatal disease. Polio is a disease that that we can translate it into high fevers, the loss of motor control, and also the loss of some of cognitive responses. So when Erickson had his first attack, the city doctors would tell him, and also his parents, that Erickson was not going to last 24 hours. So as the story goes, Erickson get very angry with the way that the doctors really said that, not only to himself but also to his parents. He asked for his parents to move his bed near the window, and Erickson vowed to himself that if he could see the next sunrise, he would survive. So it took a lot of him a lot of strength, a lot of resisting to a lot of pain management, a lot of suffering. But Erickson did saw the and then the sunrise the next day. Because of his efforts, Erickson faded and entered a coma. When Erickson woke up, he realized that he couldn't have the a motor response, so he was immobilized. He couldn't move his body, and he couldn't speak. His eyes were the only thing that he could utilize and control. So he could only stay in bed and recuperate. As time goes by, Erickson would slowly recuperate, and he tried to ask for his parents to move him near the window, so he could see his brothers and sisters really working and playing, and also it was a way that he could really had a little joy, because he couldn't move, he couldn't do anything. One day, his parents forgot to push the chair next to the window. So Erickson started to imagine and really remembering remembering the times that he would play with his sisters and brothers, and the times that he could climb to the tree and to move his body and all those kind of things. And that remembering and that state of focusing and that state of imagination went for hours and hours. And when Erickson opened his eyes, he realized that his chair moved. He was near to the window. What Milton Erickson realized is that in remembering all of those times, and by observing the movement of his brothers and sisters, his body was slowly relearning how to do those things. He was slowly auto-suggesting to his body to move in that way. So a lot of people say that was the first experience that Erickson had with auto-suggestion and all those kind of things. When Erickson grew up, he decided to go to be a doctor, a medical course in University of Wisconsin. As a specialty, Erickson took psychiatry as an advanced as one of the specialties of medicine. Everyone knows that in a certain point on the medical course, you have to choose what internship and what specialty you want to go to. So Erickson chose psychiatry. As you know, in those days, psychiatry was heavily influenced by psychoanalysis, because psychoanalysis was a psychotherapy model that was practiced mainly by physicians. Freud, Brower, all those kind of people. So psychiatry was very influenced by psychoanalysis, and Erickson started to get a formal training in psychoanalysis. However, his ideas on therapy were very different from the psychoanalytic view and some of the Freudian views of psychoanalysis. For instance, the idea of the unconscious was very different between Freud and Erickson. Erickson, in Erickson's view, the unconscious was a metaphor for a reservoir of learnings and resources that people gathered along all of the years and gathered from their life experiences. Some of the resources everyone can utilize, others are deep into the unconscious and can resurface when someone needs them to. So Erickson thought that the the task of the therapist was to communicate to the unconscious, so that the patient could could relearn or acknowledge that he has those resources and that his resources could function in his favor or her favor. In that sense, it's a very respectful and genuine approach to the patient. Also, Erickson believed that everyone is different. So my characteristics are different, makes me a different person in comparison with another person. So if I have specific needs, if my characteristics are different, the way that the therapist would work with me would be necessarily different from the way that the therapist would work with a different person. Is a tailoring perspective, is a way that someone can tailor his approach specifically to one patient. And Erickson truly believed in that. By the time that he was in medical school, Erickson had seminars and early contacts with Clark Hall. Clark Hall was a famous behavior therapist, but also a researcher in the field of hypnosis. Clark Hall was responsible by doing the first truly research-based papers on hypnosis. His ideas were social cognitive. The idea that hypnosis wasn't a state approach; it was the result of social variables, of expectancies, of role enactment, all those kind of things that progressed along the years. One of the main ideas in social cognitive perspectives in hypnosis, and it was something that Clark Hall believed, is that not everyone could be hypnotized, and in hypnotizing a person, it could mean that different persons could go into different depths of hypnosis. Milton Erickson didn't agree with that. He disagreed publicly with Hall on that notion, on that idea, and he was determined to prove that that Hall was wrong. So what Erickson did was he worked with everyone that Hall couldn't hypnotize, and he developed a way of hypnotizing everyone. In the first and the first years that Erickson used hypnosis, it was said that he wrote a 20-page induction, and slowly he shortened into a 10-page, into a 5-page, into 1 page. So he he developed a way of really focusing his communication to be very strategic, but also to individualize, to tailor that induction to different people. So if he worked with a person, the hypnotic induction would be different if he worked with another. Erickson developed a great interest in hypnosis, especially in the possibilities of using hypnosis in the medical field, but also in the therapy field. For example, he did a lot of papers. He wrote a lot of papers on the utilization of hypnosis in dental medicine, the medical applications of analgesia and anesthesia, but also phenomenons like time distortion. Erickson was one of the first ones to wrote about time distortion phenomena on hypnosis. Although Erickson changed the way that nowadays we do hypnosis, when he started, he was some of authoritarian figure. So the style that his hypnotic style, or the style that, or the way that he did hypnosis was very traditional. Pardon me. Because it was what he learned from Clark Hall. So he utilized the word sleep. He did direct suggestions, direct commands. He always tried to insert something that is different, something that is unique. He was a very metaphor-oriented person, but he was very direct in his approach. Along his career, Erickson was responsible for a lot of places and a lot of important places or placement in psychiatric hospitals. His work on psychiatry was very important, and he was a very effective psychiatrist. He also continued to utilize and research qualitatively in the field of hypnosis. So he was known as the doctor who utilized hypnosis. He worked with the American government when World War I or II really spanned. So he was very important. However, in the middle of his career, Erickson suffered a second polio attack, a second polio episode. and that episode almost killed him. So, in from a medical standpoint, the only way that Erickson would survive and Erickson would get a better life quality was that he moved into a dried, weather, a place where the weather was really dry. So he and his family moved to Phoenix, Arizona. And the first years that he moved to Phoenix, he worked at the Phoenix hospital, which one of his friends worked with him. But a couple of years later, Erickson realized that he couldn't have the strength to work that so much hours and all that effort. So he started to go to private practice where he saw clients at his home. In that time, Erickson started to communicate and started to trade some letters, because in those days people wrote letters. Nowadays we are texting in social media and emailing. In those days, the old-fashioned way, writing letters. So he corresponded with a lot of people, including the famous anthropologist Gregory Bateson, but also his wife at that time, Margaret Mead. So, inspired by their correspondence trade, Bateson suggested to one of his students and one of the people that worked in the project with him, Jay Haley, to try to get some supervision from Erickson and try to learn some things from Erickson. Now Haley started a letter correspondence with Erickson, and they struck a deal when and that Haley would visit Erickson for a week or so, and in that week Erickson would teach Haley things about therapy, and he would supervise his work. So Haley was so struck with Erickson's ideas and Erickson's approaches to therapy that he asked permission from Erickson to write a book about him. That book, that initial book, never got released. But what Haley eventually did was to wrote a book called Uncommon Therapy, the techniques of Milton Erickson, something like that. So Uncommon Therapy was really the first introduction that Erickson had to the therapeutic community, because what Haley would do was to write case studies and cases that Erickson worked on with his specific approach. Not only hypnosis, but other paradoxical interventions and his principles, like the utilization approach, or tailoring processes to specific patients, and also to be strategic on doing that. That book made Erickson well known and famous, And in a short period of time, a lot of people were asking consultations from Erickson. Not only patients, but also therapists would want to learn that style of therapy. Jay Haley and his colleagues went to develop a research a group. We did a lot of studies in Palo Alto with Paul Watzlawick, John Weekland, Richard Fisk, and after Haley left that group, he started with Chloe Mandanes a new type of strategic family therapy. So Jay Haley was considered one of the most important one of the most important people in the or persons a person in the field of strategic therapy, but also family therapy. So a lot of people try to get some consultations and some appointments with Erickson. Erickson didn't charge a lot. He really did charge very a very modest fee, but because there were a lot of people who want to be with Erickson, he could get a very good living with that. But Erickson wasn't the traditional teacher. So when a group gathered in Erickson's house to learn from Erickson's approach, what Erickson did was to do therapy with them. So they learned experientially the way that they learned how to do hypnosis was to be hypnotized. The way that they learned therapy was to do therapy or be done therapy to them. So what Erickson did was to teach them by experiencing those kind of phenomena. That is a very interesting and rich way of learning. However, in talking about an evidence-based approach or therapy model, if you don't standardize, if you don't manualize your approach, that approach can't be reproduced exactly as or systematically. So the Ericksonian approach to psychotherapy and hypnosis is very disputable because a manualized or standardized manual doesn't exist because Erickson never wrote it. What the Ericksonian approach is an interpretation based on what Erickson did and what Erickson taught. So different people have a different view of the Ericksonian approach. You can see that in reading the work of his students, the different work on his students. In saying that, a lot of people learn with Erickson. People like Ernest Rossi, Jeffrey Zeig, Brent Gary, Bill O'Halloran, Rob McKinley, Eric Greenleaf, a lot of people. At some point, Richard Bandler and John Grinder, the creators of NLP, traveled to Phoenix to watch what Erickson did in therapy, so they could model and they could reproduce exactly what Erickson did. That those encounters generated what is called in NLP the Milton model, that truly is the modeling of Erickson in NLP. So Erickson became a very famous person. When in the 80s, in the beginning of the 80s, Jeffrey Zeig, one of his close and most esteemed students, organized or tried to organize a congress, an encounter between the different therapy models that existed, but also to be the recognition of the life and work of Milton Erickson as a gift to him. That congress joined people like Carl Rogers, Carl Whitaker, Aaron Beck, Albert Ellis, Bruno Bettelheim, Salvador Michenim, Jay Haley, well, everyone in the therapy in the therapy community was at that first conference, the first Ericksonian conference. Sadly, Erickson never had the privilege to attend to that conference because he died shortly as a memory and the recognition of his work. Jeffrey Zeig created the Milton H. Erickson Foundation. The foundation tries to train, to teach, to show, and to preserve the way that Erickson did and thought about therapy and hypnosis. There are a lot of Ericksonian institutes across the world, not only in Europe but also in the United States and also in the Asian continent. For example, in Portugal we have two, and the foundation is responsible for a lot of conference. For example, the evolution of psychotherapy conference, EVO, the main conference in the psychotherapy world. Also conferences on couples therapy, family therapy, strategic therapy, and last year we saw the last Ericksonian conference. So the work of Milton H. Erickson continues to be presented in his books, in his students' books, in the work of the foundation. It's quite established the importance of Milton H. Erickson. And even if you don't agree with everything that Erickson said and did, which is the logical way, because not everything that Erickson did we can do nowadays, and also a lot of things worked because Erickson was Erickson, because he had his reputation, because of his way of being, but also doing therapy. As much as we can criticize him, it's undisputable that Erickson helped to evolve hypnosis, not only in the medical field, but especially in the therapy field. It's my understanding that without the Ericksonian approach, hypnosis in psychotherapy wasn't going to be nearly a reality, nearly a clear reality. If we can do hypnosis in psychotherapy nowadays, we have much to thank to Milton H. Erickson. I'm Ericksonian in a lot of ways. I'm not only an Ericksonian, but I'm mainly trained into the Ericksonian approach. I do agree and utilize a lot of principles. I do utilize the Ericksonian way of doing hypnosis because that indirect, more metaphorically, more permissive, more story-driven way of doing hypnosis is more suitable to me, and in that sense I really love it. But I also can look at the Ericksonian approach and say, well, that doesn't make much sense anymore, or I can dispute it, or I can find something to criticize it. It's not a way to downsize the Ericksonian approach. Is simply a way of try to make that perspective evolve into something more suitable to nowadays. And in conclusion, I would like to say that in my view, Erickson was one of the first integrative therapists that we had. In my view, Erickson wasn't recognized or clearly recognized as an integrative therapist, mainly because of his work in hypnosis, but also by the fact that he never researched or never standardized his ideas and his approaches. So in that sense, we can dispute or criticize Erickson as an integrative person. I know that this is a long video, but it's a very depth video in the life and work of Milton H. Erickson. So I would like to thank you for your time. Please be safe, and I see you next time.